Intubation is a common procedure in anesthesia and emergency medicine. It is a critical skill that medical professionals must master to ensure patient safety and effective treatment. It involves inserting a tube into the trachea, the airway that carries air to the lungs. This process ensures that the patient maintains an open airway, which is crucial for breathing. This tube helps patients breathe during surgery or when they are unable to breathe on their own. It is often used in critical care settings, such as during major surgeries or in intensive care units. But navigating the twists and turns of the airway can be challenging. The anatomy of each patient can vary, making some intubations more difficult than others. That's where stylets come in. These tools are essential for providing the necessary support and guidance during the intubation process. A stylet is a thin, flexible rod that is inserted into an endotracheal tube, or ETT, to provide rigidity and shape. This rigidity is crucial for maneuvering the tube through the airway. Think of it as a temporary backbone for the tube. It allows the tube to maintain its shape and direction as it is guided into the trachea. This added firmness allows for easier navigation through the airway and helps guide the tube into the trachea. It makes the process smoother and more efficient. Stylets are especially useful in situations where the anatomy of the airway is difficult or in emergency situations where time is of the essence. They can make the difference between a successful intubation and a failed one. They are an indispensable tool for anesthesiologists and other healthcare professionals who perform intubation. Without stylets, many intubations would be significantly more challenging and risky. Not all stylets are created equal. There are different types designed for specific situations and airway anatomies. Understanding the differences can help you choose the right stylet for the job. Rigid stylets, usually made of metal, offer the most firmness. They are ideal for patients with a straightforward airway anatomy. Flexible stylets, often made of plastic or wire, provide more adaptability for curved airways. Pre-shaped stylets, as the name suggests, come pre-bent to match the natural curvature of the trachea. These are particularly useful for anticipated difficult airways. Using a stylet correctly is crucial for safe and effective intubation. Before insertion, the stylet is lubricated and gently inserted into the ETT. The tip of the stylet should be positioned just before the end of the tube's cuff, but never extending beyond. The shape of the stylet can be adjusted to match the patient's airway anatomy. A gentle curve is usually sufficient. The ETT with the stylet is then carefully guided into the trachea. Once the tube is in place, the stylet is carefully removed, allowing the ETT to return to its original shape and the cuff to inflate, securing the airway. Section 4. Advantages of stylets: enhance control and safety. The use of stylets during intubation offers several significant advantages that enhance both control and safety. The primary benefit is enhanced control over the endotracheal tube, making it easier to maneuver through the airway with precision and accuracy. This is especially important in patients with a difficult airway anatomy, such as a narrow trachea or limited neck mobility, where traditional methods may fail. Stylets also facilitate smoother and faster intubation, significantly reducing the time it takes to secure the airway, which is vital for patient outcomes. This is crucial in emergency situations where every second counts, and rapid airway management can be the difference between life and death. By providing rigidity, stylets help prevent kinking or bending of the endotracheal tube, minimizing the risk of trauma to the delicate tissues of the airway, ensuring a safer procedure for the patient. Section 5. Safety and maintenance, ensuring optimal performance. This section is crucial for maintaining the highest standards in medical procedures. While stylets are valuable tools in the intubation process, they must be used with the utmost caution to ensure patient safety. Proper shaping of the stylet is essential to prevent airway trauma. This involves carefully molding the stylet to match the natural curvature of the patient's airway. The curve should be gentle and smooth, avoiding sharp bends that could injure the trachea. A well-shaped stylet facilitates easier and safer intubation. Always ensure the stylet is removed promptly after the endotracheal tube is in place. This step is critical to prevent any complications. Leaving the stylet in can obstruct the airway or damage the trachea, leading to severe consequences for the patient. Choose the correct stylet size for the endotracheal tube to ensure a snug fit and prevent dislodgement during insertion. The right size enhances the efficiency of the procedure. Regularly inspect stylets for any signs of damage, such as bends or cracks. Routine checks are vital for maintaining equipment integrity. Damaged stylets should be discarded and replaced immediately to avoid any risk to the patient. Always prioritize using undamaged high-quality tools.